uh, they got 5 to 6 bodies per day during the first wave. This time around, they're getting 20 bodies per day. This is the same crematorium that had 8 bodies being burned on one pyre. During the first wave, you had their highest death count was about 8 per day, 8 on a day. This time around, it has touched 32, which is exactly what makes it very scary, because the health infrastructure is already shambolic in rural areas. I'm currently in a small town of Usmanabad, where the hospital here has 400 beds and 120 nurses and ward boys who are operating in the shifts of 3, which basically means that there are 40 staff nurses and ward boys at a time working at a hospital looking after 400 beds. And that means that a lot of patients are getting unattended. I met a man yesterday who shared something really heartbreaking with me. His mother was dying on a bed. She was taking her last few breaths, and a man was waiting in the corridor so he could replace his sick patient with her on the bed, because there was shortage of beds. And he said that I can't blame him, because these are desperate times, and I would have probably done the same thing. When I speak to people about funerals, they say that the funerals are reduced to logistics. We have to worry about claiming the body. We have to worry about wearing the PPE kits and so on and so forth. We don't have time to mourn. We can't hug each other. We can't console each other properly. So it's a devastating sort of a scenario this time around. The people have panicked, and the rural area especially is in a scary scenario right now. And I shudder to think what will happen next.
Parth, that's such a emotional reminder of how difficult it is to deal with this death toll, because behind every number is an actual person and people who love them. The pandemic has highlighted the glaring wealth gap in India. In the earlier stages, it ravaged poorer, more densely populated areas of the country. Now we're seeing some of the impacts in more of the middle and upper classes as it edges into more rural areas. Tell us what you're seeing in terms of those demographic shifts.
Yeah, I mean, people often talk about how the virus has been a great leveler and all of that, and nothing could be further from the truth. Every second or third tweet on my timeline has been a cry for help. But right now, I'm in a place where people don't even have smartphones. They're not even on Twitter. They can't even seek help from somebody else. Those with access and money are able to get decent healthcare, whereas the ones that can't afford it have to rely on public healthcare, which is already in terrible shape. So the life of a poor person in India has always been cheap, and the second wave of COVID-19 has just reiterated that.
Well, India is averaging roughly 400,000 new cases of COVID-19 each day over the last 7 days. And from what I understand, you yourself have not been vaccinated because of the vaccine shortage in India. What is it like for you to report on this story without the additional protection of a vaccine?
Well, it is scary. Over 150 journalists in India have died of COVID so far. So you don't want to contract the virus. At the same time, you don't want to pass it on to your loved ones. But I mean, it's such a massive story that you can't not be in the field to document it. It's something that as a reporter I couldn't let go. So I've been traveling for the past few. I've been on the road since the lockdown in 2020.